Imagine bringing home a new puppy, full of life and energy, only to discover that a silent killer is lurking in your neighborhood. Canine parvovirus, or parvo, is one of the deadliest diseases dogs can face. In the United States, cases are still common, especially in shelters and among unvaccinated dogs. Understanding this threat is the first step to protecting your best friend from tragedy. Parvovirus is extremely contagious, spreading through feces, contaminated surfaces, and even on shoes or hands. Once inside a dog's body, it attacks rapidly dividing cells, especially in the intestines and bone marrow. This leads to severe vomiting, bloody diarrhea, dehydration, and life-threatening infections. Without treatment, mortality rates can reach as high as 90%. That's why every dog owner must be aware of the risks and symptoms. One of the scariest facts about parvovirus is how long it survives in the environment. The virus can live for months on grass, carpets, and even concrete. Ordinary cleaning agents often fail to kill it. This resilience makes outbreaks in dog parks, shelters, and urban areas difficult to control. For families with puppies, a simple walk outdoors could expose them to this deadly virus without warning. Puppies are the most vulnerable because their immune systems are still developing. Between 6 weeks and 6 months of age, they face the highest risk. In the U.S., veterinarians frequently report parvo cases in shelters and pet adoption centers. Sadly, many dogs arrive already infected. By the time symptoms appear, the disease has often advanced too far, making treatment harder and more expensive. Recognizing the early signs can save lives. The first symptoms often include loss of appetite, unusual tiredness, and a sudden reluctance to play. Soon after, vomiting and diarrhea appear, often with a foul odor or traces of blood. These are red flags no owner should ignore. Immediate veterinary attention can mean the difference between life and death, especially if supportive treatment begins quickly. Dehydration is one of the deadliest effects of parvo. As vomiting and diarrhea continue, the dog loses fluids rapidly, weakening the body and making recovery nearly impossible without medical help. Owners sometimes mistake the signs for common stomach upset, waiting too long before seeking a vet. That delay can be fatal. Every hour counts when it comes to saving a dog with parvovirus. Veterinary treatment usually involves hospitalization, intravenous fluids, antibiotics, and close monitoring. While there is no direct cure for parvo, supportive care helps the dog's body fight back. Recently, the U.S. approved a monoclonal antibody treatment that has saved thousands of puppies. However, this option is still expensive and not available everywhere. Prevention through vaccination remains the most reliable defense against the disease. Vaccination is a non-negotiable step in protecting dogs. Puppies need a series of parvo shots starting at 6 to 8 weeks of age, repeated every few weeks until at least 16 weeks. Adult dogs also require boosters to maintain immunity. In the United States, veterinarians emphasize that incomplete vaccination schedules are one of the main reasons puppies still die from this preventable disease. Despite awareness campaigns, outbreaks still happen. In 2025, states like Texas, Florida, and California continue to report high numbers of parvo cases. Urban shelters are especially vulnerable, with many dogs arriving unvaccinated or exposed on the streets. Communities with low vaccination rates see recurring spikes, proving that the virus is still a very real danger. Responsible ownership plays a key role in prevention. Families often wonder if indoor dogs are safe from parvo. The truth is, no environment is entirely secure. The virus can hitch a ride on shoes, clothing, or objects carried indoors. Even if your dog never steps foot outside, they can still be exposed. This is why veterinarians strongly recommend full vaccination for every dog, regardless of lifestyle or breed. Another factor that increases risk is the popularity of dog parks and boarding facilities. These environments gather many dogs in one space, making it easy for the virus to spread unnoticed. A single infected dog can contaminate an entire area, leaving invisible danger behind. Owners should always ask about vaccination requirements before leaving their pets in such places, ensuring proper health standards are enforced. Parvovirus also has a financial impact. Treatment costs can range from hundreds to thousands of dollars, depending on severity. Many families face heartbreaking choices when they cannot afford hospitalization. Some shelters, overwhelmed by cases, are forced to euthanize infected dogs. Beyond the emotional pain, the economic burden highlights why prevention is always better than trying to cure. In recent years, organizations have launched free vaccination clinics in vulnerable areas across the U.S. Cities like San Francisco, Atlanta, and Chicago have invested in awareness campaigns. These efforts save countless lives but require ongoing support. For dog owners, taking advantage of these opportunities is an act of love and responsibility that protects not only their own dogs, but the entire community. Cleanliness is another crucial part of prevention. Since parvovirus is resistant, disinfecting with regular products is not enough. Only strong solutions like bleach can kill the virus on contaminated surfaces. Owners should clean areas where sick dogs have been and avoid sharing bowls, toys, or leashes between animals. These small precautions can stop outbreaks before they start and protect entire neighborhoods. Parvovirus also affects the emotional health of families. Losing a puppy to such a fast and aggressive disease leaves trauma that lasts for years. Many owners feel guilt, thinking they could have done more. Education is the key to breaking this cycle. When owners learn the signs, follow vaccination schedules, and act quickly, they transform fear into empowerment and protection. The good news is that awareness is growing. With tools like ParvoTrack reporting thousands of cases each year, data helps veterinarians and communities identify hotspots quickly. This transparency creates opportunities for better prevention strategies and faster responses to outbreaks. Knowledge is power, and sharing accurate information is one of the most effective ways to save dogs' lives across the country. Every dog owner should build a habit of observing their pet daily. Watch for changes in appetite, energy, stool, or behavior. Keep records of vaccinations and ensure timely boosters. These small acts of responsibility build a shield against diseases like parvo. When prevention becomes routine, the risk of facing this nightmare drops dramatically, giving owners peace of mind. Parvo is a reminder that dogs rely on us completely. They cannot protect themselves from viruses or ask for vaccines. They trust us with their health, and that trust must be honored with vigilance. Ignoring vaccination or dismissing early symptoms is never worth the risk. A few minutes of attention can mean the difference between years of love or sudden heartbreak. If you ever suspect parvo, don't wait. Call your veterinarian immediately and isolate your dog from others. Quick action not only gives your pup the best chance of survival, but also prevents spreading the virus to other pets. Remember, parvo is not just your problem, it is a community issue. Acting fast saves lives beyond your own backyard. Thank you for watching this video until the end. At Dog Care Academy, our mission is to keep dogs safe, healthy, and loved. If this information helped you, please like this video, subscribe to our channel, hit the notification bell, and share it with other dog lovers. Together, we can stop parvovirus from claiming more lives and give our best friends the future they deserve.